Welcome to Mindcast, your 10-minute mental wellness break, brought to you by Sanitas BeWell. We're your BeWell counselors, here to talk about stress, anxiety, depression, and everyday mental health. Let's get into it.
Hello, everybody. I'm Genae Brady, and welcome to Mindcast. This is the BeWell podcast for Sanitas Medical Center. And today I have with me Kery Constantine. Kery, why don't you go ahead and introduce yourself? Let everybody know who you are and what you do.
Hello, my name is Kery Constantine. I'm a licensed mental health clinician. I've been in the health and human services field for around 18 years. And today I'm the BeWell SUD supervisor, and I'm happy to be here with you guys.
Today, our subject is on substance use disorders. And Kery, you're an expert on that. Can you please tell us what are some of the symptoms or signs that a person may be using substances?
Okay. A lot of times when we think about substance use disorders, most of the time our friends or families won't be doing drugs in front of us, but you can tell if they're going through something by isolated behaviors, a lot of whether it's impacting the work or social domains that aren't really because of tangible issues, meaning it's not something that says, they did this or they did that to me. It's mostly like more withdrawn, or I don't feel like going to work. I'm focused on a lot of activities surrounded by drug use, or I'm isolating instead of doing the things we used to do. So I'm kind of focused on behaviors that's allowing me to continue this pattern. So a lot of time when friends ask me, what's going on with you? Why haven't we seen you in a while? Or family is like, you're not engaging in activities. When their answers kind of don't make sense and they're very regimented in their routines to kind of stay isolated and kind of focus on activities that aren't really clear, then you should be worried about most likely substance use or something along those lines should be happening.
What would usually lead someone to use substances?
Okay. There are many things that lead people to substance use. You know, a lot of times people used to say, like, when you're young, when people start smoking a marijuana, that's like the gateway drug. But substance use really comes from a history. One is accessibility. You know, sometimes you grow up in environments that's accessible and people start using drugs. But the other one is predominantly coping mechanisms. A lot of times people have stressors, they have trauma, they have strict triggers. And a lot of times we don't always have access to the right healthcare options or behavioral healthcare options, and people go to the quick fix, you know, the substance use, the self-medication, the numbing. So a lot of times it's mostly unhealthy coping mechanisms and lack of access to the proper tools to help them cope better with whatever they're dealing with.
I especially agree. I do see a lot of with mental health disorders and substance use disorders co-occurring at the same time, where patients don't know that they can get access to certain treatments for their mental health. They will use street drugs, as we call it, to cope or use that as a mechanism to help with their mental health disorders. What are co-occurring disorders? Can you explain that in more detail for us?
Okay. So a lot of times people have mental health challenges, you know, the anxiety, the depression, the trauma, and other related to and the mental health part. And then when you think about the substance use disorders, the most common one is alcohol use disorder, right? We have alcohol use disorder, opioid use disorder. Another common one is marijuana use disorder. So a lot of times co-occurring, mean we're pairing it together. That means I have anxiety and depression and I have a substance use disorder, meaning that with the alcohol, I'm pairing it with the marijuana, the opioid, or a list of other drugs. So basically, when you start pairing it together, because that tells you they do have the stressors, the trauma, the triggers involved in the mental health portion, but they're coping through the substance use. So that's when we call it co-occurring disorders.
And what type of services are out there or programs are out there for patients who do suffer from substance use disorders?
Okay. So there are many programs out there. If you look at the SAMHSA website, which deals with substance abuse by the federal government, you'll find a bunch of resources. You'll find a bunch of local nonprofits that receive money for assistance with substance use disorder. And if you also look at the NIH website, again, things you can Google. When I say SAMHSA and NIH, you can Google those things. You find local resources in your community, but they're all government backed. They provide tools and resources, and they also provide agencies locally that have received funding to assist with those things. But best of all, you can hopefully find, you know, a BeWell SUD in one of the Sanitas locations. If you're in Florida, which, you know, hopefully in the future we expand, but in Florida, our BeWell counseling program is there for you for, you know, minimal issues, but the SUD program is for any substance abuse challenges. And we're throughout the state. We're in the different regions, and those are the resources that you can find for SUD. And you can always call Sanitas if you're a Florida Blue member for more information.
And what type of services does your SED program with Sanitas offer? What type of things do you help patients with?
Okay. So like I mentioned earlier, we have behavioral health counselors throughout the state. Behavioral counselors only deal with the SUD population. And within those services, we deal with people that have anxiety and depression, but significantly, the SUD is the one that's impacting them within their daily life or day-to-day tasks. So services we provide is basic case management, but we also provide referrals. So if you need a psychiatrist, if you need a therapist, we also practice behavior activation to help people get back into routines and habits of sobriety. We also motivational interviewing to make sure people are consistent and kind of going for their goals if their goal is abstinent. And all this is linked around the primary healthcare system because obviously we know that substance abuse affects our physical and mental health. So we want to tackle that all in one setting. So when we think about services, our goal is to link you to all the available services and make sure you're aware of all the available services. So if you have any challenges, you know where to go. So your behavioral health case manager should be your first point of contact with SUD to link you to all available services for SUD.
Thank you very much, Constantine, for telling us about that. This is very interesting. And we have patients that do suffer from substance use disorder. The main one I've seen is alcohol use, dependency or alcohol use disorder, things like that. We do have patients that suffer from other substance use disorders, and referring them back to you or your program, it does really do help them to remain sober and remain healthier too, mentally and physically. All right, this was great. I'm happy that we did this. I hope that you can come back onto the show to do another segment on substance use disorders as well as other mental health disorders. And if you have anybody is out there suffering from substance use disorders or any type of mental health disorder, whether it be anxiety or depression, please contact us at the BeWell program here at Sanitas. We have excellent counselors like myself and Kery Constantine. We are licensed, we are professional, we are educated, and we are here and dedicated to helping you. Thank you, Kery. Have a great day.
Thank you.